grab your markers.
Have you ever wondered
Hey, it's Dr. William. Grab your markers.
Have you ever wondered why
Lipo through the key area, round, fill in the hip, blend that into the leg.
I've got my pen and paper out today. I want to talk about.
Okay.
Yeah, okay, relax.
Welcome to my YouTube channel. Hi, it's Dr. William. Welcome to our question session today. I've got a list of questions that patients have asked over the last several months on different social media platforms. So I'm going to go through some of these, and I'd also be happy to take any of your questions. If you have some questions, just type them in the comments. That's the whole focus for tonight, is going to go through questions, and I'm just going to be talking about different topics. So if something's really on your mind, you want to ask it, then please go ahead. And I'm going to start off here talking about, it says, can you explain how fat grafting to the breast work and who it's best for? So sure, that's a good place to start. I like fat grafting to the breast or to the butt. So when we talk about fat grafting, so what exactly is that? Well, it's very similar. You've probably heard of a skin graft. And so the way a skin graft works is we use what's called a dermatome, which is basically like a electric, looks like it's actually from the 1950s. It probably hasn't changed since then, the design. And it's like a little cheese grater. Not cheese grater, but the little things you slice cheese with. You run it down the skin, and it takes a very thin layer of skin. It's partial thickness skin. And then we take that skin and we put it where somebody has lost skin, either through trauma or burn or whatever. And then you wait for that skin graft to develop a blood supply. And once it develops a blood supply, it's your own skin. And it'll grow when babies have skin grafts, or little infants, if they're scalded or something, then they have a skin graft that grows with them. And so fat grafting just came out of that. It's part of your body. It's a different tissue. And we can take that and basically transport it to another location. So you can take fat from liposuction. That's how we get the fat. We perform liposuction, either as part of a large liposuction area, like when I'll do what we call Lipo 360, which is all the way around. I'll take that fat, we process it. There's lots of different ways. We're going to talk about that. And then we'll take that fat and we'll put it into fat. And then just like the skin graft went from one location to the other, the fat will go from one location to the other. It establishes a blood supply and it grows. So that's what fat grafting is. Now, when we start talking about fat grafting to the breast, and if we look at a breast, you know, why would we do that? Why would we fat graft to the breast? Well, there's quite a few examples of why we fat graft to the breast. One of them, for example, which I don't do any longer, but I did a lot of this in the past, is with breast reconstruction. And so what that is when somebody's had a mastectomy and they've lost their breast from breast cancer, and then we go in and reconstruct the breast, you can use your own tissue, or you can use, what's most commonly done is you can use an implant. And so if you imagine that the patient has lost their breast, there's no breast on the chest, and we're going to rebuild a new breast for them, that's called breast reconstruction, then when we put the implant in, the implant, that doesn't show up very well. When we put the implant in, the implant will go in here. And it sits right under where the nipple and the areola are, if they're still present. There are a lot of times where surgeons can preserve the nipple and the areola. It's called a nipple-sparing mastectomy. So if the nipple and the areola are preserved, we'll reconstruct the breast with an implant. The problem is all of the patient's breast has been removed. So when a patient has a mastectomy, removed all the breast, it doesn't come out just as a circle. It actually comes out as sort of a tissue that looks like this on the chest. This is going towards the armpit. And so with fat grafting, that's fat grafting, what we can do is we can put the implant in, and that'll give us most of the mound of the breast, but then we can use fat to place it in all of the other areas around the implant. So I always kind of say that when we do breast, I used to tell a patient we do breast reconstruction, when we're replacing the implant is kind of like if you imagine an egg, the implant is the yolk. And then the fat grafting is the egg white. And that really resembles more of a normal, natural breast. So fat grafting can be used for breast reconstruction. And then there's also the cosmetic arena, which is where I work now all the way, 100%. So we can take fat grafting to the breast and we can use it in a cosmetic. So this is when patients they're not having a mastectomy for breast cancer, but they just want their breasts to look better. And so we can use it along with an implant. So we can use it with an implant. You say, well, why would we do that? Well, it's kind of the same way for if you imagine this mastectomy, where in particular in very thin patients, if you put the implant in, sometimes it'll just look too much like, okay, boom, there's the implant. So what we can do is we can take, if you imagine this is the breast, is we can take and we can put the implant in, but then we can also fat graft. And the most common places that I fat graft when I combine it with fat graft with a breast implant, with breast augmentation, is I'll focus on the cleavage, so the middle part here, and also this upper pole. And so that will fill this in as well. And so fat grafting is really helpful for that. There's other times if somebody wants to remove their implant, they no longer want a breast implant, well, it can be really difficult because you've got your volume, you've got your shape, you've got your cleavage, you've got your upper pole fullness, and then we take the implant out. And if you don't have very much tissue on your own, then you're going to be left with a very flat breast. Now, somebody doesn't want to have an implant, so they also don't want to be totally empty and flat. So that's where fat grafting comes in. It's like a happy medium. We can remove the implant and we can add a little bit of fat. Now, we can't always add the same amount of fat as the implant. So if somebody had, let's say, a 350 implant, we could maybe only put in, so let's say that's the implant of fat, then we would probably put in about 150. Then the reason is because when you put an implant in, the implant goes into a pocket and it takes that whole space. But fat, you can't just shove a bunch of fat into that pocket. It won't survive, it won't grab a blood supply. It has to be it has to be sort of feathered into the fat. So if you imagine, if that's the skin here, and then you've got a layer of dermis, and then now you've got your fat, okay, this is the fat cells. So you can't just put the fat in this plane because it won't survive. You need to have some fat to receive the fat so that it can develop a blood supply. So with an implant, you put it into the pocket, but with fat, you can't put it into that pocket, so you have to put it into the tissue, into the fat, and so your new fat grafting goes in here, and that's why we're limited in the amount we can put in, because we're putting it into the tissue and we're not putting it into a pocket. So I also use fat Excuse me. I got a little frog in my throat. We can also use fat grafting when patients are having a breast lift. And we can also use it when they're having a breast reduction. And this one here, both of these, we're doing the same thing. When we're doing a breast lift, we're lifting the breast. When we're doing a breast reduction, we're lifting the breast. In a breast lift, we're not changing the size of the breast, we're just lifting it. In a breast reduction, we're lifting it and we're making it smaller. So why would we put fat in if we're making the breast smaller? And you've probably heard me talk about putting an implant in with the breast reduction, which is a bad idea. So why would I then use fat in the breast reduction? The patient wants to be smaller. It's because we don't use a lot, but we strategically place it. And one of the problems when you do a breast reduction is trying to get that upper pole fullness. That's why people want the implant, is they want to get the upper pole fullness. But the problem with an implant and a breast reduction is it just drops, so you don't get the upper pole fullness. But with fat, you do, because the fat goes into the tissue. And so if we're looking at, well, let's draw it laterally here. Where's my eraser? So if we're looking at a breast here and we want to get more fullness in this upper part here, that's where we can put fat. And the nice thing is, unlike the implant, which in particular in patients with breast reduction, the implant can really start to drop and bottom out. Whereas the fat, it's placed in the tissue, it's up here. It just gets integrated, it just grows, blood supply becomes your regular tissue. Then you can get some upper pole fullness with your breast reduction that actually lasts. And we can do some in the cleavage too. It's really nice. It's not a lot of fat, so it's not going to change the fact that you're getting reduced. It's not going to give you this huge breast. Sometimes we only put maybe 75 cc's in here, which is not very much. Remember, 1 ounce, like the little NyQuil sort of cups, is 30 cc's. So it's not going to change your volume significantly, but it changes your shape. And that's why we can use fat grafting. So I do it with a lift, I do it with breast reduction, implant removal, I'll do it with an implant. And sometimes patients just have a breast that they would like bigger, but they don't want to have an implant and they don't really want to go that much bigger. Then we can do it just for a straight breast augmentation. So usually when you think of a breast augmentation, you're thinking of an implant, but we can actually do a breast augmentation with just fat alone. So it's very nice because you can go and have Lipo 360, get a better shape, and then some patients say, hey, you're going to do Lipo, you're going to have that fat, can you put it in my breast? So we'll look at a breast and we'll talk about it and kind of come up with a plan. So fat grafting to the breast is really, really good. I do it a lot. It's relatively new, and I'm talking like 10, 15 years compared to when I first started. We didn't fat graft to the breast at all. We didn't fat graft to the breast because we were worried that radiology would not be able to determine if the patient had cancer versus the fat that we put in. But we now know after studies that that's safe and that radiologists can determine that's fat graft, that's breast cancer, or that's suspicious or whatever. They can make those determinations. So fat grafting is very safe. And it's used all over the face. It's used all over the body. Of course, used in the butt. So, okay. That is good with fat grafting. Anybody have any questions about fat grafting? I can't hear you, but I can read. So send it, put it in a comment. It always takes about 3 or 4 pumps and then I break that. And I don't have my handyman here to fix it tonight. Although Oscar's filling in for the handyman, and Oscar does a great job, and I appreciate Oscar tremendously. If you were to know this man, he's a wonderful person. Okay, so shout out to Oscar. And while I'm giving shout outs, I don't know if you can see Frankie's over here. I always keep Frankie up here on the wall just because he's my dear friend, and I'm always working with him in anesthesia. I spend more time with Frankie than my wife, unfortunately. But Anyway, 2 shout outs. Now, let's move on to a different question. And are the results from a BBL permanent, or do you need touch-ups over time? So, yes, the results are permanent because, as I was showing you with that tissue diagram, when you put fat into the tissue, it grows a blood supply. Your body doesn't know if that fat cell was grafted from a different area or whether it was always there. It just grows, it gets blood supply, and then it's permanent. It just stays with you. People have a concept that the BBL will disappear with time, and it's just not true. Now, you can lose fat with weight loss, and you can gain fat with weight gain. So if you had principally just a breast augmentation with fat and you gained a significant amount of weight, then most likely your breast will get bigger because those fat cells will get bigger. Same thing if you have a BBL and you gain weight, your BBL will get bigger. You lose weight, your BBL will get smaller. But the cells just shrink and grow and shrink and grow depending on calories coming in and calories coming out. More calories coming in, less coming out, fat cells get bigger. So the BBL is permanent, and do you need touch-ups? The answer to that is, I would say, different now maybe than I would have answered that question 6 months ago. And that's because of something really interesting, and I will have access to it very, very soon, and it's something called Alo Clay. And so this is a new product, and what it is it's cadaveric fat. So cadaveric, I don't know if that's how you spell cadaveric. Maybe that's an A. Cadaveric fat. What does that mean? That's fat from somebody that's moved on. And they process it and they remove the cells of it, so there's no DNA in it, and it's really just a structural fat. But the nice thing is we don't have to take it from you, so there's no lipo. So there's no recovery from the lipo. So that's something I'm going to start using soon in patients who would like a touch-up after BBL. So I think this is really exciting because I think there's a lot of really good uses for it, and it's going to be a relatively no recovery essentially because there's no lipo. And I'm not going to do it under a big heavy anesthetic, probably just something very light, just to give you a little relaxation, and it's not going to be particularly painful, particularly big recovery. So it's really good. But that that would be called sort of a touch-up. And what I think it would be really beneficial for is a chicken butt. That's where I think it's going to help me out a lot because I do correct chicken butt, but the frustrating thing about chicken butt is you can't completely correct it. And so what happens is chicken butt, for those that don't know, and I didn't name it, but it's where you tend to have a flat crease here and you'll have like an area of tension. So you kind of get a little indentation and then you have a little area that hangs out. So it sort of looks like this, and so it's difficult and patients don't like it. And so when I do a BBL, I'll try if I see it, which is way more common because it's a spectrum as far as chicken butt is concerned. With some people have very mild chicken butt and some people have more severe. These patients are really, you can't totally correct this patient. This patient you could probably totally correct. But for most people that are living in this kind of main area, we're going to get a significant improvement in their chicken butt with the BBL. But if they have a little bit of residual chicken butt here, and usually I don't put fat here, so this doesn't get bigger. And we're trying to sort of make this look like this. So this is always the tricky spot here because it's very tight. This is very tight here. So I put fat here. I don't put fat here because I don't want that to hang more. I'll put fat here, but I can't always get, that total correction, so I can get it like, maybe like that, or maybe like that type of thing, or, maybe like this. So there's various amounts that I can correct it. But the nice thing is when you put the fat in during the first BBL, that will help loosen that tissue. Fat is a wonderful softener of tissue. I was talking about the breast reconstruction patients when they have mastectomy and they had radiation. You fat graft there and their tissue gets soft. It really, really surprised me the first time that I saw it. And fat is wonderful at softening. So I think that what we're going to be able to do with chicken butt is if somebody has pretty good correction but not 100%, now they have some fat there, so I can graft into it. And I think I'm going to be able to use some Alo Clay, get better correction of that. So that would be a touch-up after a BBL. The other thing that I anticipate that's going to be very good for are any kind of divots or dents. And so it's really the same kind of idea. A lot of times you'll see that here. Someone will have a dent, or they'll have a significant depression. And it's the same thing. I'll tell patients, yes, I can improve it, but it's most likely that I can't completely correct it. Well, I think that's going to be a great place for Alo Clay. They're going to have some fat in there after their BBL. The tissue is going to be softer. It's going to be more receptive to taking some fat. And so we don't have to go through and do lipo and everything. Take some of this Alo Clay. It just comes in a syringe, ready to use, and I can put it into that area. So I think we're going to be able to correct dents. People are talking a lot about correcting hip dips with this. I think this is a weaker indication. I think maybe for some people who have very small hip dips, it'll be helpful. But the results that I've seen so far are kind of iffy, in my opinion. But because, remember, if there's a hip dip here, and we're trying to correct it, let's say with a BBL, so let's just say we have a hip dip here, then what we want to do is we want that to come out, obviously, so we get that nice OG line. So with that convex part, right? So remember the concave part's up here, that's with the lipo. But if we are unable to completely fill in a hip dip, then yes, I think Alo Clay would be great for that. But starting off from scratch, filling a hip dip there, I don't think the Alo Clay is big, it has enough volume. You'd have to use too many and it would become cost prohibitive. Because the hip dip itself goes all the way back, usually. It's variable. This distance here is variable. Some people here, and a lot of people kind of go this way. So when you correct the hip dip, I know it makes sense. You'd be like, oh, well, just put some fat here, I'll be done. But it doesn't work that way because you have to support that fat that you laid here. You've got to support it. It's kind of like a little trench that comes in here. And so you've got to put fat wherever this line goes. If it's here, if it's here, if it's here, wherever it is. It's usually not up, but once in a while it goes up. But it's usually somewhere in this area. So you have to graft in here in order to graft and support the hip. So I don't think it's going to be that good. But the other thing that I think Alo Clay is going to be wonderful for is going to be cellulite. And cellulite, and I think I'd use Alo Clay for the cellulite plus the Aveli. So that's the little device that goes in and cuts those attachments. If you look at it, say, let me use this green. So if you look at, let's say you've got, cellulite is sort of when you have this, cottage cheese looking here. And what happens is these little areas are tethered. And so these are tethered down. And so the Aveli will come in and just like a little, it's really kind of a cool device. It'll come in and sort of hook on this thing, and then you pull it back and it cuts it. It doesn't hurt. It's really easy. It's really pretty non-painful. And it'll cut these. So you'll get a little bit of that area starting to come up, and that'll even you out. The problem is your body will want to scar again. And so those little tether things are going to want to go down. Not all of them, but it happens. So that's where I think you put the Alo Clay right in here, and that will help even this out. And I think you'll get a more even contour in here. But I think it's a good to combine this with the Alo Clay as well. So these are kind of the places I'm going to start when I'm doing touch-ups and with Alo Clay, and that, to me, that's really exciting, because in the past, if you have somebody with a small little divot, they're not really going to want to go through lipo all the way again just to get some fat to do that, or have an anesthetic, all that stuff. So I think this is a really nice way. I think that was the second question. So, so the problem is I keep talking. Okay, so let me see here. Let me take some live questions here. Let's see. Okay. Donette Johnson is asking, is 56 a safe age for BBL, and how long after gallbladder removal can you have a BBL? So usually after surgery, a couple of months for you to heal any type of surgery then it's safe to have another surgery. I mean, you could have surgery next day, but it would be a nightmare because you're trying to recover from these two different things. So we'd never want to do that. So recover from your first surgery, heal to the point where you're back normal, and then it's safe to have another surgery. And in terms of your age, 56 could be totally fine. Somebody at 46 could not qualify because they have medical problems. Somebody at 56 who's not overweight, who's not on a lot of medication, who's exercises and is otherwise healthy, then yeah, they could be a great candidate. It's not so much age as it is health. All right. Marcy is asking, can Alo Clay be used for breast augmentation? Super good question. I don't think there's going to be enough. You have to remember that it comes in smaller aliquots. When we do liposuction ourselves, we have unlimited fat. We can take whatever fat we want. But when Alo Clay, it's limited. So I don't think it's going to be as good for just wide-scale breast augmentation. I think it will be, perhaps, if we're doing an implant and there's a little area that we need to use, maybe it's going to be good for that. But as a primary breast augmentation, I don't think it's going to have enough volume for us. Let's see. Brandy Cordova, she's 5 weeks post-op BBL, when will it get soft? It's variable. Softness is variable as when it happens for patients. Some patients are soft relatively soon, and honestly, it surprises me. But I would say typically, usually, at about 6 weeks, patients are soft. Remember, when you're going through a BBL, there's a couple of stages to it, and so I'm going to get rid of this chicken butt here. I wish it was that easy. Imagine a little magical spray. This little pump is not working so well. All right, let's see if we can do this. All right, oh good, look at that. All right, we're cooking with gas here. Okay. Okay. Your dad ever say that to you, or?
Yeah.
Yeah. We're cooking with gas now, son. You know, you're like, that was always fun. Okay. I don't know what he was cooking with before. So, what am I talking about here? I lost my train of thought. Oh, softness. Okay. So, with recovery from a BBL, this is the way I think of a BBL. So, I think of this as your date of surgery. Okay, that's the day that you had surgery. And then this is your recovery. This is your pre-op. Okay? And so this is your pre-op, and this is your recovery here. And there are certain kind of landmarks that you're going to go through. The whole recovery for any surgery, which I know sounds crazy when I say it, but it takes 12 months. At 12 months, you're going to be, you won't even know that you had surgery. Your scars are going to look good. Your tissue's all going to be soft. All the swelling's going to be gone, and you're totally normal. Now, at 6 months, you're also, I'm going to just cheat this down here because I want to draw on the other part. At 6 months, you're going to be pretty good as well. The changes from 6 months to 12 are really just a tissue kind of softening and the final bit of fluid leaving. The fluid that's there swelling, that's what gives you firmness. So here in this recovery phase, if you break this down into weeks, and let's just call, I'm going to just call that 16 weeks. Pretend that's not, wasn't months there. Okay, that's 16 weeks. So during this phase, we have no sitting during this period of time. Right here, no sitting. No sitting. Here, we go sit on a BBL pillow. Then once you hit 4 weeks, you sit normally for the rest of your time. That's the sitting. Now, why do we do that? Why don't you just sit right away why can't you just sit right away? Well, it's because that fat that's just been grafted is just trying to find its way, find a blood supply, just trying to hang on and survive. So if you put pressure on it during this time, then you're going to kill it and it won't allow it to establish a blood supply. So we do that, no sitting for 2 weeks. We use a BBL pillow because that's kind of a transition. There is going to be some pressure at some time on your butt in the area that grafted fat when you're using a BBL pillow, no matter how good you are at adhering to the BBL pillow. So it's a little transition, which is fine. We don't mind that. We don't want a lot, but we don't mind a little bit. It stresses the fat. And so during this, that's why we do this. Now, during this time, you're going to go through a lot of swelling, because the swelling typically sort of goes like this and then it slowly comes down like that over time. That's your 6 months, that's your 12 months. Don't worry, that should be 0. This goes down to 0. So you're going to swell. This happens in the first 3 days. You're going to have a big uptake in fluid and then it's going to start to go down. You're going to get a fairly good reduction by 3 weeks and you're going to get a much more reduction by 6 weeks, and then this is kind of a slow curve here to the 6 months. So when we're talking about, well, I keep losing track here. She was asking me about recovery here. Oh, soft. Sorry. Okay. So when we get, when are you going to be soft? Well, you're not going to be soft here because that's where you're picking up fluid, and with that fluid, it becomes firm. And you have to wait for the fat cells to establish a blood supply to get soft. So they're going to be getting swelling, they're going to be establishing their blood supply, and then they have to start getting rid of this swelling before you start getting soft. So typically, patients will start getting soft in this area. Now, I just said some people are soft early, which I don't understand. I'm just going to tell you that. But usually at this point is where people are starting to get soft. And that happens to be at the same point where you go through this fluffing phase. And what the hell is fluffing phase? Well, I one time dressed up in a fairy godmother, which, was quite funny. My wife didn't think it was that funny, but it was pretty funny to see a fat guy in a fairy outfit, I'll tell you that. If you haven't seen it, I don't know where it is, but it's on YouTube, you should find it. And you'll get a good laugh, and you'll probably show a lot of people. So anyway, this fluffing stage goes about 6 to 12 weeks. And what's happening at that time? What is it? What's going on? Well, I haven't dissected or done microscopic studies or whatever. I just tell you what I believe happens is that at this time, these fat cells are really small when you're starting, because they were just taken out by liposuction, which is kind of must be a big shock to those fat cells. They're sitting there minding their own business, then all of a sudden a vacuum comes and whoosh, they get taken out. Well, when they get taken out, they're dead. And so when you first put them in, they're kind of in shell shock. And they need to establish the blood supply, and then they start to get a little healthier. And so once they get to sort of, I think, this phase, they're kind of more healthy because they've got a strong blood supply They've got a strong blood supply. So now they're good and they're okay. And then I think what happens is they go through like a little change where they start getting a little more fluff. And so that's why patients will say their BBL got a little bit bigger, or they notice they got a little larger, a little fuller, because these cells, I think during this fluffing phase, go on and they get a little bit bigger because I think they're getting healthier. So that's kind of how the softness works. It's variable from patient to patient, obviously, but usually kind of in this area, we're starting to see patients getting softer. So if you're at 5 weeks, you're getting close. And usually what I found in medicine, in looking after patients a long time, is it's usually patients will, right when things are kind of starting to change, that's when they're worried that they're not going to change. Because they've been patient the whole time and they're getting to the end, it's like, oh my God, when's this going to get soft? It's usually when that starts to get soft. So that's a short answer for saying about 6 weeks. Okay. Oh, Nicole Latrice, you're saying, what is the difference between a skinny BBL and regular? Do I offer skinny? Ho! I just had this conversation today with a patient, and let me explain to you, because there's some confusion. I'm really glad you asked that question. These are things I would never think to talk about. It doesn't cross my mind, but this is great. So, all right. So what is a skinny BBL? Okay. It's not what you think it is, I bet. So to me, a skinny BBL is somebody who is skinny and they have very low fat. So when I look at them, I'm thinking, oof, does this patient even have enough fat for me to do a BBL? And the answer to that is most of the time is yes, because just so happens to be that usually patients that are very skinny, they have smaller butts and they don't require as much fat. So I can do the BBL and fill in the hip dip and give volume and projection and put it in the leg and all those things. I can do that, but I have to be really careful and mindful of how much fat I'm using where I'm putting it. So this is, if you look at our canister, maybe somebody typically will have that much fat, but if we're talking about a skinny BBL, they may only have this much fat. It's enough fat. It's sufficient fat to do a BBL. But I can't, if I had that much fat on a little small butt, I put the fat in and I don't need to keep track of every single cell because I've got plenty. So once I get the shape, I'm finished, and then there would be fat left over and we throw it out. But with a skinny BBL, there is just enough fat. And so I use every drop of the fat, and I'm very careful as to where it goes, very strategic. I think what people think now of a skinny BBL is something different. This is what I hear patients telling me is I want a skinny BBL, but they mean more like a BBL light. Like a diet BBL, a small BBL, not a big BBL, small BBL. Well, I don't call it the skinny BBL in that situation because usually those patients have sufficient amount of fat. But what I do say to them, and what I understand when they say I want a skinny BBL, even though they have plenty of fat, is they value, if you're looking at this, they value shape over size. And they focus on the shape. And that is, I guess I should draw it like that. They value this shape more than they want size. They don't want a big butt, they want a pretty butt. Well, if that's the definition, then I've been doing skinny BBLs my whole life, because I also value shape over size. I don't see the benefit of having something that's big and doesn't look good, but is big. I mean, that just doesn't make any sense to me. It never has made any sense to me. So I just do the same thing. I follow the OG line However you spell OG. I just follow the OG line and it'll get me that shape. And then I just use enough fat to get the shape. Now, if patients want to have volume, bigger volume, patients will come in and say, I want a nice big juicy butt, or I want full. So that's fine, we can do that. And that's where we start to value the size. I never violate the shape to get the size. I'll always add the volume, but keep within that shape. But I think when people talk about skinny BBL, they mean BBL light. That means they're more interested in shape. Guess what? I am too. I think that's the most important thing. But it's what I think of a skinny BBL are somebody who's really, really small, barely have enough fat to do the BBL, but we can do it. There you go. Okay. Oh my God, Frankie's on here messing with us. Do we lose sensitivity after breast reduction? The answer to that is usually no. It's possible, but the answer is usually no. And in fact, what I've seen many, many times is the opposite. Patients will actually gain sensation because the distance of their nerve to their nipple and their areola was so long before that nerve was under traction, and then you lift it up, and all of a sudden patients are like, wow, I can feel my nipple and areolas. I haven't felt that for years. So possible to lose sensation, not very common, and it's also sometimes you'll actually gain sensation. Do I work on patients with sickle cell? No. Sickle cell disease? No. You can have plastic surgery, anesthesia, dehydration, those things, and it can trigger a sickle cell crisis. So for that, no. If you have sickle cell trait, that just means you carry the gene, then yeah, that's fine to have surgery. Diet BBL, yes, exactly. Oh geez, Frankie's on here asking questions. Good night, everyone, I'm done. Thank you, Frankie. Evie, how much is cost? I don't, as surgeons, we usually don't discuss price. It's kind of we distance ourselves from that, and the reason is because we would do everything for free because people are nice. What happened to Jackie O? I don't know who Jackie O is. Is that someone who had a bad outcome from surgery or something? I don't know. The only Jackie I know is Jacqueline Onassis Kennedy. Okay, Malik, hi doc. How long does your stomach stay hard after lipo and skin tightening? I think these questions are plants. Is Malik work in the office? Because that's a good question. And so I'd like to answer that. How long does your stomach stay hard after lipo and skin tightening? I think it's two different answers. The skin tightening, I know this makes me old, but I'm not that big a fan of it because it's giving you're tightening. You know, do you know why skin will tighten? It tightens from scarring. The contraction generates scar, and that causes that to tighten. So I personally don't like things that have energy to them to be applied when I do lipo, because I think it makes the tissue much more inflamed. I think you hang on to the fluid longer, so I think you're harder longer, and this is not like some type of Cialis ad. And so I think you have that swelling and it stays harder, and I believe strongly with all my being that thermal energy done with either skin tightening or done at the time of lipo is increasing fibrosis. And my focus is to not have patients with fibrosis. So I spend a lot of time educating patients and trying to get them to do things that will decrease the amount of fibrosis or just eliminate it. That's why I have FiberGuard, that's why I roll, that's why I have the faja, that's why we do manual lymphatic drainage massages. All of those things are aimed at one thing, and that is activation of the lymphatic system. This system, everyone's heard of lymph nodes, right? We've all had sore throat or cold, or you know, you get like a little lymph node or behind your ear, under your jaw, under your chin, or in your neck, sometimes in your armpit, sometimes in your groin. And so, But the lymphatic system is so critically important. We spent, 2 minutes on it in medical school because you don't see it. So it's a really difficult system to imagine because you see an artery, you can see an artery, I mean, you cut into it and blood will come flying out depending on how big the artery is. And then you can see the arteries, they go into veins. And so these keep splitting into small little capillaries and all that stuff. And then you have a similar system on the other side that goes into the vein. And so these things all form and they go into the veins. So these are veins and these are arteries, and this is your capillary bed. That's where this is where all of the exchange of fluids and nutrients and oxygen and carbon dioxide, all this stuff, it's going on in this capillary bed. Well, then just kind of sitting there, minding its own business, but actually doing strong work without any recognition, unsung hero, is the lymphatic system. And the lymphatic system's here, and it's here, and it's got these little tiny things that you can't even see them. They're transparent, they're clear, and the fluid that's in them is clear. And they're working and they're doing. And what are they doing? Well, for surgery, they are taking out the swelling. They're taking out the swelling. They're the ones doing the heavy lifting, taking out the swelling. That's what's getting the fluid back to your kidneys, and you pee it out and you get rid of it. So this lymphatic system, in my mind, is critically important. And so we know that with certain things, manual lymphatic drainage, FibroGuard, which is a foam garment, and rolling, even the faja adds some benefit. All of these things go and they activate the lymphatic system, and that gets rid of the swelling. So I want the lymphatic system to be charged up and working the best. In my opinion, when you put the thermal energy in here and you cause that tissue to shrink because it gets hot, it heats up, it contracts. That's where you get the skin tightening from. Although it's not going to replace a tummy tuck by any stretch of the imagination. You'll get this whole stuff kind of squeezes down and contracts, and you're going to deactivate the lymphatic system. And that's why I think patients that have skin tightening or they have thermal energy with their lipo, they're harder for a longer time because the lymphatic system is not being activated. I'm going through one question an hour. Okay. Let's see. Otis Mayer Munoz says, when I do a tummy tuck lipo 360, do you lipo in the upper abdomen? Yes, I do. But you have to be careful when you do lipo of the upper abdomen. So I don't do the same degree of lipo in the upper abdomen during the tummy tuck as I would do if we weren't doing a tummy tuck. Or I don't do as much in the upper abdomen as I do on the flanks and the back and the key area. Because if I do too much in that upper abdomen, it will cause problems. Let me put it here. Can you see this over here? Yeah. Okay, so let's just say this is the tummy tuck. That's where the scar is. And so we're talking about this area here of lipo. So the answer to that, yes, I do. But I do a little bit less than I do in the other areas for those reasons. We don't want to disturb the blood supply. Because remember, when we do a tummy tuck and we lift up this tissue, well, what are we doing? When we lift up that tissue, if you imagine this is your skin, and you have blood vessels that are coming up supplying that. Well, those vessels, a lot of them are on the belly button, but there's other ones throughout. In order for us to lift this skin up, we have to cut these blood vessels. So I don't want to go into this area which already has a lower blood supply. I don't want to go into that area and then do crazy lipo because I will injure the blood supply and we'll have a problem. So you can do some gentle lipo up there, and I do it. Well, why would I even do gentle lipo in that area if I did what I just said? Well, because when we're moving this tissue down and we're removing all this tissue here, when we go to close things, you can have a discrepancy in the thickness of the tissue you're trying to sew together. So when I'm putting this incision back together, I'm sewing the tissue from here to the tissue here. And this tissue up here, if it's really thick and this tissue down here is thin, it's hard to line this tissue up to get a nice flat incision. So I like to take a little bit of the fat out to narrow that so that I can easier bring these together and get a flat line. So I like to do it for that reason, but I will usually tell patients it's not going to be as much as in the other areas. No, let's see. Erica says, hello, I'm 28. I'm wanting to get a BBL. I have very little body fat, so you'd be a skinny BBL. Your BMI is 19 to 20. I'm wanting kids in the next 3 to 4 years. Will this affect my results? No, and this is something that I get asked frequently. I love that. Everyone's always asking me these questions. That's the intro to every video. They were asked one time. Okay, so it's not going to affect your pregnancy at all. It's just we're removing fat from one area, or your 360, and then we're putting fat in. So that fat becomes your own. So when you are pregnant and you gain weight, then your butt will get bigger depending on how much weight you gain. But it's not going to affect you getting pregnant, carrying a pregnancy, or anything. It doesn't change anything at all. Let's see. I guess I don't. Jackie O is somebody that went to a different surgeon. I don't know anything about that. I'm sorry. I'm not aware. How long do you recommend, Jen's asking, I like your little avatar. How long would you recommend waiting to start going to the gym after having a tummy tuck with lipo and muscle repair? Well, every tummy tuck, in my opinion, that I've done includes muscle repair. So just a tummy tuck has muscle repair in it. And how long you can go to the gym? Usually, that answer is after a tummy tuck, 6 weeks. For me, after lipo, you can go whenever you like. I don't have any time. BBL, whenever you like. I don't think exercise is going to damage you. It's only a wonderful thing. And if you have lipo or BBL, only restriction I have patients with BBL, no sitting. Lipo, I don't have any restrictions. They can exercise as soon as they like. Tummy tuck, we want to wait 6 weeks because your body takes that long to get the strength needed. At 6 weeks, you usually have 90% of the strength you will finally have, which is about 90% of the strength that your tissue originally had. So 6 weeks is safe to do that. So how come I don't give blood thinners after BBL to prevent DVT? You can. I don't think the data necessarily supports that. Even like 2 days later, once the bleeding has subsided. Well, it's not good. You can't start blood thinners just willy-nilly, because when you actually start a blood thinner, you actually go into a hypercoagulable state. You're actually more likely to get a blood clot for a short period of time. So we don't just start them later. And usually at that point you're starting to walk, and walking is the best way to prevent a DVT. So the data's not there, and from what I understand, to use it, so I don't use it for that. I do use it for tummy tucks because the data is there. So with tummy tucks, I usually start at 6 hours after their surgery. Are the lipo back incisions at the bra line? They are, but there's also ones that are higher up. you have to have the incisions where you need to make them in order to be able to remove the fat. So many times I've seen patients come in and they have just, if this is their back, they have one incision here. And every time they have a lot of, so this is their back, they have a lot of, the arms are up here, they have a lot of fat still left over in the bra fat area, all, in this area, because the tools that we use for lipo are rigid. They're stainless steel. So they're just a solid, they're, about this long. And so you can't go around a corner with them. So you have to make multiple incisions to be able to remove the fat. And you also don't want to just lipo kind of like this. You want to come at it from different locations. So you want to, it's like cutting the grass. If you want to get like a really nice cut to your lawn, you cut it this way and then you cut it this way as well, because the little things that you may miss this way, you catch them this way. And with lipo, we go this way and this way and that way and that way, because we want to have thorough, even fat removal. And that requires multiple incisions in order to do that. Okay, let me see. Let me take one of these that somebody sent a few days ago. Let me see. What type of implants do you usually recommend? Saline, silicone, or gummy bear? Okay, that's a good one. That's a pretty long one. Let me see if I can do that in a reasonable amount of time, because I'm only going to be here until 8 o'clock, which is coming up very quickly. So let me ask, I'm going to do this. I'm going to answer this question, and then I'll take one more question online, and then we'll call it a night. The reason I'm calling it a night early tonight, because usually I talk for so long, is because one of my sons came home today and from college, and I haven't seen him for a long time, and I'm dying to see him. Okay, so we're talking about implants. So saline, gum, okay. All right, so if we're looking at implants here, there are, in general, two different types. There's a saline implant and there's a silicone implant. Now, the saline implant, in my opinion, are not as good as a silicone implant. I don't use very many saline implants anymore. They are harder on the tissue, they have more rippling, they don't feel as natural, so I tend not to use the saline. There is an implant that is out that is a saline implant that has some properties like a silicone implant because it has a different design. And if you did want a saline implant, then I would use that implant. But traditional saline implants, they're not as good. If you don't want to have silicone and you want saline, then I put saline in. But most people would prefer silicone. Now, with silicone, there's been a lot of changes in the development of implants over the years. Implants were used first off in the 60s. And I think this surprises people because that was a long time ago. I know because I was born at that time. So it's been used for a long time. And they started putting it under the breast, then they went under the muscle, all that stuff. But I'm not going to talk about that story. These are the generations of implants now that are, when they've had significant change in the implant design, they'll say this is a new generation. It's kind of a consensus. So right now, we are living in this era with 5th and 6th generation implants. So if we look at the manufacturers right now, we have Mentor, we have Allergan, and these are just the ones that we're talking about available in the United States, because there's many more around the world. Mentor, Allergan, Sientra, and Motiva. These are all 5th generation implants. This one here is 6th. That's Motiva. I should write a little neater. Motiva. Okay. This one has been used in Brazil and all around the world for, I think it's 12 or 15 years, but just last September it got approval by the FDA to be used in the United States. So for me right now, that's, I think, the best implant. Now, these are gummy bear implants. So in the past, we had different style. One was really a gummy bear. And what a gummy bear means is just a more cohesive implant. And it's the way the manufacturers have bonded the silicone that's there, and they bonded it. And when they were first starting, these ones, if you cut them open, they just poured out like water. And the reason I know these early ones is because I've taken out a lot of implants over the years, and a long time ago, 20 years ago, we were taking out a lot of these implants. So these ones, the silicone was much more liquid. In these ones are more cohesive. So they stick together better, and it's easier on your tissue, and they feel better, they look better. There's a lot of advantages to them. But the gummy bear now, in my mind, is the same as these terms. Gummy bear or silicone or gel. These are all synonymous, these terms. They just mean a highly cohesive implant, which all of these implants are now. And so they have a lower capsular contraction rate, the capsular contraction rate, the Motiva, than the other implants do. So I think these ones, they're newer, they look better, they feel better. So I'm a huge supporter of the Motiva implants. I think they're wonderful. Okay, I'm going to take one more live question, and then we are going to wrap it up. I'm going to go see my son. Thank you, love from Australia. I'd like to purchase FiberGuard and OG Faja. I don't sell, we don't ship them internationally. The OG products are only shipped in Canada and the US. So I do get people saying, hey, I live in England, or I live in the UK, I live in wherever, and I can't get it. A lot of people in Dubai seem to be trying to get it. And I feel badly because we don't ship, but OG Recover is like a really small, tiny little company. It's principally been used for my patients, but there has been demand, so we do have, sell them and ship them in Canada, United States. But internationally, we started, and it was just too difficult. People weren't getting them on time. Customers were holding them up for a long time, or they're getting lost. And it just became too much for our little tiny company to kind of manage. If we were able to become a big company, then yeah, sure, I'm sure we would do that. But I don't see that happening for quite a long time. Okay, I'm going to wrap it up there. I really appreciate you watching. I appreciate all your questions. You can always leave a comment. Just comment on one of my videos. I go through the comments. You should actually read the comments, because sometimes I'm pretty snarky and sarcastic on there for when people say for the 10,000th time, she could have just worked out and got that. And I'm like, it's not like that. It's not that working out is bad. Working out is great. You should do both, in my opinion, if you're trying to get the best result. But one doesn't do the same. What we do in surgery is not, you can't do that. We can't do that in the gym, but what you can do in the gym, we can't always do it in the operating room. So they really work together. But if patients want to divide them into these things and then call everyone lazy for having plastic surgery. So sometimes I get a little heated there, and I'll engage people there. Okay, that's it. Thank you very much for watching. I appreciate it. And we're doing another live on May 21st, is it, Oscar? I think it's May 21st. Yeah, so I'm going to be doing another live on May 21, usually at 7 p.m. And this one I'm going to be talking about tummy tuck. And we're going to go through everything about tummy tuck. I know tonight we were talking about all different things, which is what I wanted to do. It's fun to do. But I'm going to focus on tummy tuck, and I'll put together a presentation which I have. And we're also going to be, and you're also going to get the guide, which is really, really, really good because it's got everything you need to know about having a tummy tuck, and it's just free for watching it. That's it. I'll see you next time, May 21st. Have a great evening. Thank you, Oscar. I really appreciate it.